This is Florida Gulf Coast University.
You probably don't have to look far to find someone involved in youth sports, from Little League and Pop Warner through the many sports in high school to the young adult sports at the college level. But with that involvement comes the risk of injury, the science of preventing it, and thankfully the method of treating it. More about sports medicine and injury prevention on this edition of FGCU Perspectives. Our guests, Mike Estes, who is the head athletic trainer at FGCU, Randy Popple is the university's strength and conditioning coordinator, and Jim Blankenship is the head coach of women's soccer. Thanks, all of you, for being here today.
Thank you.
Mike, sports medicine and injury prevention important in all sports, but when we talk about youth sports, it's maybe even more important.
It's very important. With our youth level sports and our athletes, that's when they're starting to get involved. That's when you want them to have a good experience. And in order to have a good experience, it needs to be a healthy experience. And from my standpoint, that starts with the pre-participation physical examination. They've got to have a physical before they do any type of activity so that whoever, the coach, the athletic trainer that works with them, know that they are of good health to be out there doing what they're doing.
And important because of their age, especially when we're talking about the younger kids too.
Especially because of their age, because again, they should be having annual checkups with their doctors, with their family physicians, but unfortunately, that's not always the case, and they depend upon that free physical that's provided by whatever their sporting body is providing them. Should never take the place of their annual physical. But yes, absolutely, they have to have that physical exam so you know their health status before they start. That's where injury prevention starts.
And Randy, we talk about injury prevention, sports medicine, but avoiding the injury is something you'd rather do to begin with.
Yeah, and for us, it's getting a good warm-up before you get out there, getting the kids to understand what you're really trying to accomplish and make them realize that the warm-up is as important as the participation in the sport, because without a good warm-up, you may not participate in the sport. As we talked about, you could end up with that injury that you don't want to get. So you have to have a good dynamic warm-up with the kids, a good routine that's solid that they repeat over and over again. And once they learn it and get comfortable with it, it works very well.
And a level of fitness and a level of strength is important as well.
Yeah, I mean, the coaches have to realize, and at these levels, that you have to start everybody out understanding that nobody may be in condition to go. So, and especially when it's hot and you don't know what the kids have done to hydrate themselves before the event starts. So when you begin practice, you want to make sure that you start everybody as a beginner and then work your way up from there. Don't jump into it too fast, and don't assume that children are going to have a good background of physical activity before coming in.
And Jim, not too long ago, a conversation about youth sports would have been solely about boys and young men. But in today's world, it's very appropriate to have that same concern and consideration for girls and young women.
Absolutely. You know, women's soccer is probably the fastest growing sport in the country. You know, so it's not uncommon to go to any park any night of the week and see, it just inundated with people playing, so it's, it's growing, and participation's important, and, it's at the point now where they're playing year round, so the injury prevention is huge.
Is there sort of a list of common injuries that you deal with, or that kind of run through all sports?
I think the most common injuries that we see are the sprains, the strains, and the contusions. The bumps and the bruises, if you will. The mild injuries that don't necessarily need to go to the physician, but the ones that moms and dads and grandmothers and grandfathers seem to take care of at home. So I think it's important for the coaches involved with the youth leagues that they have sound understanding of proper care for the basic injuries, so that they can pass that on, whether it's through clinics with the parents, so the parents know when to use heat, when to use ice, so there's not a conflict there that could actually make the injury worse than it really is.
And knowing when to seek the advice of a professional?
Well, yeah, and the big thing is to understand when it's time to back off a little bit, especially early on in participation in something. If it's your first day and you start to feel some soreness or tightness, you need to slow down then. You need to back off a little bit so that your participation will continue through the next few weeks, rather than, doing the wrong thing with the ice or heat. Doing the wrong thing by pushing yourself through something early could cost you 4 days of activity where you can't participate then. So if you notice something early on and you back off a little bit early, by the next day or two you'll be fine and can go the whole time instead of missing 3 or 4 days completely because you pushed through something. So you have to understand when your body's talking to you. And the hard thing is with young kids is they have not been participating in a lot of sports as long, don't understand their body as much. So you have to kind of educate them as they go along as to what's going on when someone does have something like that happen, so that they can learn to listen to their body.
And it is something that you have to learn, the listening part.
No question, and I think a parent has to be involved in that process, because at the youth level, it's a little bit different than us, where we're dealing with athletes every day for training. The youth level, you're usually training twice a week, and then games on the weekend. So you really have to have a good line of communication, not only with your child, but with the coach. That making sure that soreness doesn't turn into something that's going to linger for a long time.
Jim, I would imagine for every youth athlete that has kind of come up through organized sports, there's another soon-to-be youth athlete that has not come up through organized sports, just is in good fit condition and wants to try out for a sport. Are there special concerns for somebody like that?
Well, at the youth level, I mean, participation, it's what it's based on. So the club sports, they hold their tryouts. Depending on where it's, which area of the state it's in. I mean, there are hot pockets for soccer. So their numbers are going to be a lot larger than maybe some of the smaller areas. But I think everybody wants to play. You got neighbors who see their kids playing. You have friends who play, and a big part of the youth scene is that social aspect. So, yeah, I think you're going to do, as a club coach or a youth coach, you're going to be dealing with kids that have quite a bit of experience, and you're going to be dealing with kids that want to kind of get in the arena and play.
Any injury prevention concerns, though, for that group?
Well, I think with all of them, you have that. The social part of it's an important part of that kid growing up and playing. Especially at the younger ages. So they might not be the typical, young lady who we get, who is more have done it as maybe a profession. It's no longer just a social environment, going to the field 2 nights a week to be with her best friend. So that with that group, I think the coach and parent has to really pay quite a bit of attention to that. Because they're doing it for the first time. They're going to deal with some issues that maybe a kid who's played 4 or 5 years, a little bit more experience, and knows how to pretty much take care of themselves after the training, in between trainings, in between games, with rehydration, stretching, and all the prevention stuff.
Are there, Mike, general rules of thumb that you could give to a parent or a starting out athlete about things that they need to do to keep from getting hurt?
I think the most important thing is they need to listen to their children, because a lot of times the parents, they perceive what they think is correct without actually hearing what their kids are telling them. And having worked in the back office with an orthopedic surgeon in the past, and some of the cases that we see come in, some of these things have gone on for a period of time, and it wasn't until it got to the point that they just flat out could not participate anymore did they make it to the physician. So again, going back to what Jim had said, communication between the coaches and the parents is huge. It can't be stressed enough. The parents have to understand that they have a role in this, that when the kids come home to them, as far as hydration strategies,
right,
as far as soreness and what that means, is it pain, is it injury? You got to figure all those things out. And again, the coaches are going through certification courses nowadays that are teaching them that. That needs to be relayed on to the parents. And again, the most important thing is the parents just need to listen to what their kids are telling them.
You mentioned certification courses. Much more known today about how the body works in a sports standpoint than 10 years ago or 20 years ago.
Oh, that's absolutely correct. There are even programs for parents in some areas where they just want the sport to be safer. We know we've seen a rise in certain injury rates with certain youth sports, and coaches now have to go through mandatory training. We see it at the high school levels where they have to have their safety course. We see it in the middle schools. We see it down in youth league. Obviously, at our level, as Jim alluded to, we have a network. We have our own sports medicine staff. We have our network of physicians. We have pretty much anything accessible that we would need But at those lower levels, that's not always the case. But again, the parents just have to listen to what their kids are telling them.
From a strength conditioning standpoint, as people get kind of tuned up to participate in a sport, how important is rest?
Well, rest is one of the key components. You have rest, nutrition, hydration, and flexibility. Those are key things in what you have to do. And talking about what Mike was and Coach were talking about as far as communication and stuff goes, I work a lot with Little League soccer with I have younger kids, and I'm on the board with Little League baseball. And one of the big things parents I think have to realize is that, you know, there's that mentality there sometimes with some parents that, oh, it's just a bump, oh, it's just a bruise, you know, don't worry about it. But they do really need to listen to their kid, like Mike said, because that can become a problem if you don't. And I think what I've seen, the big thing I've seen is parents are too quick to let something go. You know, Johnny's really not hurt, he'll be okay. But, you know, that's fine in the game. But once the game's over, they need to address that thing and get after it and make sure they ice it or whatever they need to do and follow up on it. As far as from the strength standpoint of things, I think with a lot of kids, if you know your kid's going to try out for Little League soccer or your kid's going to go try out for Little League baseball, you need to get out with them and make sure they're active before. You need to get out and let them run a little bit. Go out and do a little bit of running thing. Find some drills. I mean, nowadays with the internet, it's amazing the things that you can find on the internet. You can just type in baseball conditioning drills, and you're going to find a tremendous amount of things that you could do that are very basic movements with your kid before you go out there and before they try out, things that they can do. Throw. If your kid's going to try out for Little League baseball, you definitely should take your kid out and play catch with them for a while. Don't have your kid go to Little League baseball tryouts the first day without having thrown a ball at all. Because then they're going to be sore that first day. They're trying to impress everybody. Their adrenaline's flowing. And it's the same thing with soccer. You're going to have your kid go out there and they haven't been doing much. They've been playing video games or something for a while and haven't been very active. And then you send them out to tryouts for Little League soccer, and the coaches want to see how quick these kids are. Sometimes they set up agility drills for kids to go through, run through some cones and things. And if your son or daughter haven't done anything,
Right.
their chance of getting hurt is much higher, because the adrenaline level and what they're going to do is going to be much higher than what they would normally play outside. So at least if you know your child is active before they go into these tryouts, you're really going to help them tremendously.
And definitely the same true for soccer. That was baseball as an example, but soccer would be the same way.
Absolutely. You know, to the extent with our college team, we come in August, we give them a 12-week running and conditioning and lifting program to prepare them for that first day. You know, so, I mean, that's obviously magnified quite a bit. You know, we're a high-level team, so we want our kids prepared. But, you know, it's the same at every level. You know, you have to have some kind of preparation, and you have to have a foundation if you're going to go play. You know, and I think the kids or the families that run into some of those issues are the kids that, I mean, the weekend warriors, where, you know, they put on the cleats that Sunday and they play, and they're going to be sore for 2 or 3 days, and they go through that same process weekend after or weekend out, you know, and it's important. You know, it's probably, I would say probably the most important part is just that foundation, getting yourself a good basis and knowing how to prepare for what you're going to get into. You know, and the youth programs are year-round now. So, you know, that's another phase of this, is just knowing when those windows of recovery time are and making sure you take advantage of those as well.
So the injury does happen. All your best efforts didn't put this one off. What do people need to keep in mind when they do have a child that's suffered a sports injury?
Well, I think the first thing to keep in mind is the young kids generally have never been hurt before, especially the first timers, and they don't understand what's going on with their body. They don't understand really what is pain and what is injury. So again, it's real important to be patient and to have them describe what they're feeling, what kind of pain they're feeling. Obviously, you're not going to be able to teach every parent, you know, how to do assessment on the entire parts of the body, because that's what degrees are for and medical professionals are for. Ice compression elevation immediately is always important, and when there's any doubt whatsoever, you know, that's what 911 is for. You know, and don't be afraid to use it. Oftentimes, the parents try to take care of it and they try to handle it because they know them better, and they're not listening to what the child is saying, and they end up, you know, the injury is exacerbated, if you will, because they waited too long to seek care for it, and what could have been a very simple sprain to care for is now turned into a greater injury because of improper or lack of care at the time. So the basics, ice compression, elevation, that's the simple for our sprains, strains, and contusions, which we see probably 95% of the time in this population. Going back to heat illness and not being acclimated, obviously if there's any type of heat episode or collapse on the field, that child has got to be rushed to the emergency room. And that doesn't mean that you take them yourself, because en route things can go bad real quick. That's when an emergency action plan should be in place wherever they're playing or practicing. EMS is brought into the mix, and EMS transports them. You should never transport a heat-stressed victim yourself, because things can go bad real quick.
And at most of the events, there is some kind of emergency medical service there.
Generally speaking, like at our level, like we'd said, as a high-level Division I program, we have those resources available. Sometimes, though, as my kids grew up playing youth sports and then now into high school, sometimes there's medical personnel on site, sometimes there's not. Sometimes there's EMS on, sometimes there's not. Most of the time, probably, especially for practices, there will be no EMS present. So it's important to have that plan so everybody knows exactly, coaching-wise, Little League administration-wise, what the plan is. So if it has to happen and the call has to be made, everybody knows their role in the plan.
And I think it's not a bad idea either for the parents. I think a good thing for the parents to do is to be involved. And just remember that these youth sports are not babysitting places. You need to be involved so that you know what your child is going through. You need to be there as often as you can and watch them practice, see what they're doing, see if they get hurt, know what happened, so that you understand. Sometimes the kids can't always tell you what happened. So it's better if you're there and you're paying attention to things that are going on. And there is an emergency plan for all these youth sports. And it's a good idea for the parents to understand what that plan is, because then if your son or daughter do go down because of heat or something else, or a broken bone or a tear in a ligament or something like that, they understand the process of what's going on. So they don't sit there with their hands tied behind their back and not know if anything is actually being done or not, because there always is that emergency setup for every youth sport that's organized. They have a plan of what's going to happen, who calls, and where they're coming from, and how long it'll take them to get there. Little League is an example. Last year we had a kid trip going to third base, fell, hit his head on the bag, and his neck was bothering him. So, we didn't want to play with that. And everybody knew what the plan was. We knew the person that was going to call. We knew how long it would take him to get there, so we could tell the parent exactly what was happening. These are the things that are going to happen right now, and this is how long it's going to take. And it takes a lot of anxiety out of it if you understand what that process will be.
Talking about the resources that are available, I guess it grows as the level of competition grows. You must have wonderful resources available here at the university.
I think we do. I mean, we have a staff of 7 certified athletic trainers, which means they all have degrees and they're all licensed to practice as ATs in the state of Florida. We have a wonderful group of support physicians. They're not on campus. They're in the community, but we have access to them for whatever specialty we need. We have an extensive emergency action plan so that if we do have to bring EMS in, they know exactly who is going to be there, the qualifications, that the AED, the oxygen is already going to be there and being administered. They know there's a certain level of care that's taking place. So we have a great relationship with Lee County EMS and with our local physicians and hospitals. I mean, we have a plan to get our kids through the ER when we need to get them through the ER. So we're very fortunate. A new university grown from the bottom. I've been here since almost the beginning of athletics, and it's still a plan in progress to make sure that those services work when we need them.
And they do, though.
They do, and unfortunately, yes, we do have to use them as much as Randy and the coaches and the staff do to prevent, and my staff do to prevent injuries. Injuries are part of the game. They're not really accidents. Injuries are part of the game, and as parents, you have to understand that. There are going to be injuries. They're just going to happen. That's the nature. Just like there's going to be runs put on the board or goals put on the scoreboard. Injuries are going to happen. You just have to have that plan on how you're going to care for them when they do.
So an injury does happen. The rehab process, kind of getting back into action, must be a real organized event as well.
Absolutely. It's obviously, injuries happen. you know, you have to have a plan in place, you know, because at many times you can't, obviously you want everybody healthy and playing for the entire year, but you know, you have to deal with those, and that process is important because ultimately you want to have your best players playing, or all your players playing for the full season. You know, so the rehab program almost starts immediately, you know, and it's about communication with the training staff, you know, and the process of setting them up, you know, setting up a program in place where either they're seeing, you know, treatment off campus or they're seeing treatment on campus. A lot of that injury window or that time that they're going to be out can be reduced with a really good program, and a program that starts immediately. And Mike's group has done that. You know, we've been blessed at our level, you know, with both people here. You know, with Mike and his group as far as treating our players, with Randy doing the strength and conditioning program for our team. You know, so it takes quite a bit of burden off us as coaches, where we can prepare for what we, you know, obviously specialize in, and that's the training and teaching and trying to get results in games.
Taking a look at the kinds of things that a parent might do for a student who's just getting ready to get in sports. You mentioned getting them out, getting them active and doing things. What else can they do?
Well, you know, the old exercises like push-ups and pull-ups and doing dips, those things that you handle your own body weight with, those things are tremendous exercises. They'll never, you know, you can never replace those. And as a youth, they're even more important than ever, because, you know, you really do not want people training with weights and equipment of that sort until they can have proper supervision and be in a safe environment. And usually, you know, I try not to encourage that till kids are at least in 9th grade before we get into that. For, you know, there's many reasons why. One, for the body to be prepared, and for the other, to have that proper supervision. You're usually not going to have that until you get at least to the high school level. And there's, you know, it's very good to do the body weight stuff, the push-ups, the pull-ups, lunges, single leg squats, single leg heel raise for your calves, side lunges. So there's many activities that you can do carrying your own body weight, and a lot of people would be very surprised how difficult it is to do that stuff, and may not realize that they're not as strong as they thought they were, even as older adults. And I've done that with some of our athletes. You know, P90X is a big thing on TV, but a lot of those exercises are exercises that have been around for years. And, you know, you just put all that together in a systematic program and come up with something. And it's a real shock to some athletes to realize that they cannot handle their own body weight like they thought they could, because they've been in the weight room using the machines, and just picking up weight or changing the pin in a machine is not the same as carrying yourself around. So those are great exercises, body weight exercises, outstanding way.
And no matter what age.
Any age, exactly. You know, that's what play is all about as a kid, growing up. You know, going out, playing kickball together, playing whatever games you might play, pretending you're balancing on a balance beam, things like that. That's all activities that we all did when we were younger, and now tend to not quite be as popular as they were in the past, just because there are other things out there. But if you can get your kids active outside and doing those kind of things, those are the things that are going to help prepare them for when they go into these youth leagues and start playing sports.
And something tells me that everything I've just heard is as appropriate for us old fogies as it is for the kids. That if we're going to play the weekend warrior role, we've got to be more fit maybe than we are.
Oh, you're absolutely correct. And, you know, even going back to the very first thing that I said a few minutes ago about starting with that physical exam, for our adults that are going to go back and get active, that's the first thing you should do, is consult your physician, just to make sure that everything is okay before you get going, because something can happen and then it's too late. So all of these things, and to kind of add something to what Randy said, I know, having grown up in the hills of Kentucky, you climbed the hills, you played in the creeks, you climbed those trees, you made tree forts. We did so many things outside. We never were inside unless it rained, and we hated to be inside. But kids today have a tendency to be more inside inclined as far as, you know, house dwellers. They like to play video games, they like to watch TV, listen to music, and they're not as outdoor active as we once were when we were younger. So again, it's important that you get out of that protective house and acclimate to the surroundings before you get out there.
And part of the thing is too, like this time of the year, as we all know, it's really hot. And, you know, I get my kids out as much as I can, but at the same time, you got to limit that, because it is very hot. And they can get stressed outside in that kind of heat. So you have to realize that we're not going to be as active, especially this time of the year as we might be when it's a little cooler out. So it's another reason to understand that, we have to be prepared if we're going to go into something, some event. And it's a big thing with athletic training, is your body acclimatized to be able to handle that temperature and that time of day? So you have to let your kid can't be an indoor kid all summer and then go to a camp for a week and be an outdoor kid in the middle of the day. So you need to understand that it's a good idea to try to prepare them with that, to hit them to spend some time outside at the same time before the camp start that they're going to be spending during the camp time, so that they can get acclimatized to that a little bit.
And in our part of the world especially.
Yeah, I mean, it's huge here. With the humidity level, you sweat, it doesn't evaporate, you don't cool off as fast. And then, you can be out in Arizona, it can be 105 degrees out there, but you're dry because your sweat evaporates because the humidity's so low, and it doesn't seem near as hot as it does here. Now, I've been in both climates in the job I had before, and it's a huge difference. It's like Mike said, he was out of town, got back, got off the airplane. You step off the airplane when you haven't been in Florida for a couple days, and it hits you right in the face.
Well, gentlemen, thank you for joining us. I wish you a safe athletic season, and thank you for watching this edition of FGCU Perspectives.